The NHS continues to be in crisis. Today marks 100 days since Labour came to power. So here are three things that they promised they were going to do before they were elected and have failed to do. Number one, Darcy, in his review of the NHS, said that austerity was one of the biggest problems with the health service over the last decade. Why is the government not talking about properly funding the NHS so that it's able to provide care for people who need it? They should be talking about that, and they're not. Number two, £10 million a week leaves the NHS in profit as a result of outsourcing. Why is the government not talking about bringing back into the NHS outsourcing contracts when those contracts end, in the way that they're doing in rail? And number three, PFIs have been one of the most disastrous policies on the health service and on public services overall for the last 25 years. Some NHS trusts are paying £1 out of every £6 in their budget to service their PFI debts. Yet, this government is talking about introducing more private finances into building NHS hospitals. That would be disastrous. The government has the next 4.5–5 years to correct course. They're working on a 10-year plan for the NHS now. That 10-year plan must include plans to end NHS outsourcing. They must end the £10 million a week leaving the NHS in private profits and bring outsourced services back in-house when those contracts expire. They must ban all new PFI contracts of any kind, and they must listen to patients and put patients before profit.